I'm the Vice Chair for Quality, Equity, and Safety here at Massachusetts General Hospital in the Department of OBGYN. And that's a role that I sort of crafted a little bit because there are many departments that have quality chairs, but I really wanted to make sure that for our department, equity did not get left behind. So it's really important to me that people sort of always see equity as a part of quality. The work that we do here at Mass General regarding racial and ethnic disparities or inequities in a care is really aimed at making sure providers and patients understand the differences that patients from different communities face in terms of their outcomes and of the care that's provided to them, so that we can help to mitigate that through the awareness. We certainly know that inequities arise at the level of the provider, so how we take care of our patients is really critical, and we know that there are many, many differences in the way that we take care of patients based on who the provider is and who the patient is. And so we've done a lot of work in terms of understanding our own implicit biases. We've asked all of our providers to do an implicit association test, for example, and that's part of the onboarding process. But it really doesn't end there. We've done other unconscious bias trainings. We've done sort of department town halls where we spend time talking about race, ethnicity, and how those might play out in the clinical space. And then we actually, when we do adverse event reviewing, which is a central part of my job as the quality chair of the department, what we've asked everyone to do as they present patients is to present their demographics up front. So let us know, what's the patient race, what's their language preference, what's their insurance status, so that as we review the case, we can understand are there opportunities that we might have done better in terms of the clinical care, and was any of that informed by who the patient is. I think we also think about inequities that they rise at the level of the healthcare system, and so sometimes that feels like things that we as providers can't fix, but we can influence them at the level of advocacy. So how we pay for healthcare, how we think about QA within the healthcare system, how patients are able to or not able to access our care. And then lastly, we know that the structural factors that influence their health that we, again, feel like we are not connected to, but we can have a role in. So things like housing insecurity or food insecurity or structural racism. I think it's very important for all of our providers to understand how each of these things contribute to their OBGYN outcomes and understand how we can influence them. In terms of future advancements in patient care, what I hope really is that anything that is designed that improves the health of our populations is applied equitably. And I feel like that's my role, is to understand what's coming down the pipeline and how are patients going to be able to access that, and are all of our patients going to be able to access that equitably. One of our favorite collaborators, I think, is the Disparities Solution Center, and so the work that we do on the annual report on equity and healthcare quality really works with that center to understand what are the underlying inequities in the care that we're providing, and how do we then sort of intervene on them. And so we've been really grateful to have that group as partners. We also are able to be outward focused, and so I think a lot of folks here in our department spend a lot of time both in regional and state and national platforms to bring back the best practices that we are working on here and to sort of pay those forward. So I have the honor of being the chair of the Massachusetts Maternal Mortality Review Committee, and so that work I think is incredibly powerful to understand the causes of deaths of women in this state that we then sort of roll up to a national level to understand how we can make change.